According to Greek mythology, the legendary heroes Achilles used yarrow to heal his battle wounds. In folk medicine, it's considered as a remedy for digestive issues, fever, bleeding disorders, and inflammation. Yarrow, or Achillea millefolium, is a plant with small, normally white flowers and hairy, feather-shaped leaves. It's also known as nosebleed plant, old man's pepper, and military herb. The plant belongs to the same family as sunflowers, dandelions, daisies, and marigolds, the Asteraceae. Achillea in its name derives from the legendary Trojan war hero Achilles, who supposedly applied the yarrow to his battle wounds to heal them. The genus Achillea includes over 100 species, but the name millefolium refers only to the yarrow. It translates to 1,000 leaves from Latin, alluding to its exquisitely divided leaves. Yarrow is native to Europe and Western Asia, but is widespread in most mild to warm regions of the world. The plant is extremely adaptable. It grows from sea level to high altitudes, from grasslands to open forests. Yarrow has been used for centuries as a folk remedy for digestive issues, wounds, bites and nosebleeds, inflammation, infectious disease, menstrual problems, hemorrhoids, water retention, high blood pressure, diabetes and liver disease. Today, oral yarrow is approved by the British Herbal Pharmacopoeia and the German Commissionee for fever, common cold and digestive complaints. Based on FDA and the cosmetic industry data, experts conclude that topical yarrow is also safe at doses commonly used. People traditionally use the yarrow for digestive problems, nosebleeds, wounds, insect bites, infections, and certain chronic diseases. It's rich in antioxidants and anti-inflammatory compounds. It may kill infectious microbes and parasites. It can improve skin health, promote wound healing, improve digestive issues, improve cramps, multiple sclerosis, and anxiety, and it can prevent liver damage and heart disease. It's been researched for its ability to fight an array of infections, from parasites to viral and bacterial disease. Tonsil inflammation is a common cause of a sore throat, and it's usually due to viral infections. In a clinical trial on almost 250 children with this condition, a multi-herbal extract with 0.4% yarrow, added to conventional therapy, improved the symptoms, reduced the use of painkillers, and accelerated recovery. Leishmaniasis is a parasite infection, and it damages the skin. The yarrow extract improved this condition in mice. However, a topical gel with 5% yarrow twice per day was ineffective in clinical trials on 60 people with a severe form of this disease. Additionally, yarrow extracts kill various parasites that cause malaria, Chagas disease, toxoplasmosis, and hydatid disease in test tubes. The yarrow essential oil inhibited the yeast that causes thrush or Candida albicans. Food poisoning and skin infections from E. coli, Staphylococcus aureus, Salmonella, and Listeria were all affected by the yarrow. It can help with cavities by affecting Streptococcus mutans. It can help with pneumonia and stomach ulcers. To add to its effect on infections, yarrow can also aid skin regeneration. You rarely see it mentioned among the top herbs for skin care, although this effect has been researched as widely as all the other potential benefits. In 2 clinical trials on 83 women, a topical cream with 2% yarrow extract improved the appearance of the skin. It enhanced skin renewal and reduced wrinkles and pores. Since it increased the growth of the cells that can also make hair follicles, the yarrow may also boost hair growth. In contrast, an oral herbal mix with yarrow wasn't more effective than a placebo in another trial on 44 people with eczema. In a small trial on 23 people with skin irritation, the yarrow extract dissolved in olive oil and sunflower oil, applied on an irritated site twice a day for 7 days, moisturized the skin, restored its normal pH, and reduced redness. Yarrow's potential effects are more than just skin deep. It may also aid in the healing of wounds, connective tissue, and the mucous membranes. In a clinical trial on over 100 women recovering from an episiotomy, a surgical cut that facilitates childbirth, an ointment with 5% yarrow improved the wound healing. Used twice a day for 10 days, it reduced pain, redness, swelling, and bruising. It may also help with oral mucositis, or the painful mouth inflammation that commonly results from chemotherapy. In a clinical trial on 56 people, a mouthwash improved the mouth injuries, especially when more concentrated 50% yarrow extract was used. Topical creams with yarrow extract accelerated wound healing in rabbits, possibly by increasing collagen production in the skin cell. The extract of 2 close yarrow relatives also enhanced wound healing when applied on the skin of rats. In test tubes, yarrow extract caused skin connective cells, or fibroblasts, to increasingly grow, divide, and move, speeding up the healing process. A couple of trials indicate that yarrow extract may speed up the wound healing when applied to an injured area. Yarrow abounds in flavonoids, plant antioxidants with proven effects on preventing cramps and relaxing the muscles. In a clinical trial on almost 100 women with frequent menstrual cramps, a tea made from 4 grams of yarrow flowers reduced pain better than a placebo. The women drank 3 bags per day during the first 3 days over 2 consecutive menstrual cycles. Bowel contractions help to mix food with digestive enzymes and to move stools, but uncontrolled they can cause diarrhea, bloating, and pain. The yarrow extract reduced contractions in a small study on animal bowel tissue. In the airways, excessive contractions can cause lung blockage and various diseases, including asthma, bronchitis, and COPD. The yarrow extract relaxed the airway muscles in guinea pigs, suggesting its potential to improve the lung disease. In a clinical trial on 60 people with IBS, a herbal mix of yarrow, ginger, and boswellia reduced stomach pain and bloating. One of the most common causes of indigestion is reduced stomach motility. This delays stomach emptying. The yarrow extract increased the stomach motility and the emptying in mice. It also activated stomach muscles in tissue studies. Yarrow probably aids digestion thanks to its choline content. The body uses choline to make acetylcholine, the main neurotransmitter of the rest and digest, or the feed and breed, parasympathetic nervous system. This drives cholinergic activity in the body, relaxing blood vessels and helping the gut to soak up nutrients. Additionally, yarrow extract protected the inner lining of the stomach from ulcers caused by irritant substances in rats. Bile is crucial for the digestion of fats and the absorption of fat-soluble vitamins in the gut. It's produced in the liver, and it may be low in people with gallbladder or liver problems. Yarrow extract increased the bile flow in rats' livers. According to a couple of small studies, yarrow shows promise for improving digestion and bile flow. The extract of a close relative of yarrow lowered blood pressure and blood fat levels in a clinical trial on over 100 people. In rats, yarrow extract lowered blood pressure by relaxing the blood vessels and acting as a diuretic. The yarrow extract also promoted the growth of new blood vessels in cells, and it reduced inflammation. Scientists think it may prevent the clogging of the arteries or atherosclerosis. In a clinical trial on 75 people with multiple sclerosis, a yarrow extract at 250 to 500 milligrams per day for 1 year slowed the progression of the disease, and it reduced its relapse. It altered the growth of brain lesions, and it improved daily movement and cognitive function. In mice and rats with multiple sclerosis, both yarrow extract and its flavonoids, apinogen and luteolin, reduced the severity, the progression, and the relapse of the disease. In addition to improving IBS symptoms, a herbal mix with yarrow extract reduced anxiety in a clinical trial on 60 people. Yarrow extract also reduced anxiety in mice and rats. In a clinical trial on 36 people with liver cirrhosis, a herbal medicine with 16 milligrams of yarrow reduced liver damage and restored liver function. People took yarrow long-term, 3 tablets 3 times a day for 6 months, attesting to its safety. In mice, yarrow extract, both alone or as part of a multi-herbal formulation, prevented liver damage caused by toxic chemicals. The extract of a close yarrow relative had the same protective effect in guinea pigs. In people with chronic kidney disease, high blood levels of the inflammatory nitric oxide prevented platelets from clumping together and increasing the risk of bleeding. In a clinical trial on 31 people with this problem, yarrow flower powder slightly decreased the blood levels of nitric oxide and its byproduct. The yarrow may have a more powerful effect on excessive bleeding with higher doses and longer use, but this has yet to be proven. Several of yarrow's compounds have anti-inflammatory activity. Although it can be used orally, its liquid extract is more commonly applied directly to the skin to relieve pain or to reduce irritation. A topical gel with a yarrow extract was as effective as a conventional anti-inflammatory drug, diclofenac, at reducing paw swelling in rats. In another rat study, liposomes with yarrow and oregano extract relieved inflammatory pain. In test tubes, yarrow extract and essential oil lowered the production of inflammatory compounds and it deactivated inflammation-related pathways. Messengers, cytokines, pathways, enzymes, and immune cells. Yarrow contains multiple antioxidant compounds. The extract is rich in polyphenols like luteolin, quercetin, apigenin, rutin, and chlorogenic and caffeic acid. Yarrow extract showed antioxidant activity in test tubes and in cells. These antioxidants can boost general wellness. They can help to prevent various chronic disease markers by increased oxidative stress. Certain substances also increase oxidative stress. For example, nicotine reduces male fertility by worsening free radical damage in the testicles. The antioxidant compounds from the yarrow extract protected male rats from testicle damage caused by nicotine. In diabetic mice, yarrow extract alone or in a multi-herbal extract reduced blood sugar levels and insulin resistance. It also increased insulin production and prevented damage and complications from free radicals. In diabetic rats, it protected the cells in the pancreas that released insulin by blocking inflammation. The extracts of 2 close yarrow relatives also improved diabetes in mice by lowering blood sugar levels and protecting pancreatic cells from oxidative stress. In cancer cells and animals with tumours, a yarrow extract and its components were active against many types of cancer, like pancreatic, laryngeal, lung, colon, breast, liver, cervical, skin, and leukemia. In these studies, the yarrow killed cancer cells, reduced tumour growth, and increased the effect of anti-cancer drugs. Yarrow extract also reduced DNA damage caused by anti-cancer drugs in bone marrow cells and X-rays in white blood cells. Altogether, this suggests it may help to prevent some of the adverse effects of chemo and radiotherapy. Yarrow may cause allergic reactions when repeatedly applied to the skin. The symptoms most commonly reported are redness, itching, and eczema. Because yarrow has the same allergy-causing components of other Asteraceae herbs, people who are allergic to plants of the daisy family should avoid using it. When taken by mouth, the side effects were less common and mainly consisted of diarrhea, nausea, and skin reactions. A woman working with decorative dried flower arrangements developed allergic asthma in response to yarrow. In male mice and rats, megadoses of yarrow extract reduced sperm quality, but only temporarily. In pregnant rats, yarrow extract reduced fetal weight, although the amount used was 56 times the normal human dose. Yarrow shouldn't be used during pregnancy until further research is carried out. Yarrow increased liver damage caused by paracetamol in mice, so oral yarrow extracts should not be combined with this drug. You should talk to a doctor or pharmacist before taking yarrow if you're taking any over-the-counter or prescription medication. The effects of yarrow on skin renewal and irritation, bleeding, and cirrhosis have only been tested in clinical trials with small populations. Studies on skin hyperpigmentation, ulcers, inflammation, cancer, and most infectious diseases have only been investigated in animal and cells, so more trials on larger populations are needed. Some studies use yarrow as part of multi-herbal remedies, and this makes its contribution to the effect observed difficult to evaluate. Yarrow can be taken by mouth as a tea, powder, tablet or capsule, a tincture or an essential oil. While some of these forms can be applied on the skin for wounds and rashes, the following skincare remedies with yarrow are more common: ointments, salves and gels, a poultice with a paste of ground yarrow, a compress dipped in yarrow tea or tincture, or fresh yarrow leaves. The part of the plant mainly used is the dried flowering shoot, either whole or chopped. Yarrow extracts can be standardized to the contents of their active compounds, like the flavonoids, but there is no official requirements. In turn, the shoots must contain at least 2 milliliters per kg of essential oil with 0.02% chamazoline, according to the European Pharmacopoeia. The fresh leaves can also be used in recipes. They have a delicate, sweet taste that goes well with salads, seafood, soup, egg dishes and desserts. If you find the taste too strong, you can dilute the yarrow with other soft herbs like parsley. Clinical trials used topical yarrow at the following doses. For leishmaniasis, a 5% yarrow twice a day. For skin appearance and irritation, an extract with 2 to 20% yarrow twice a day for up to 2 months. For episiostomy healing, an ointment with 5% yarrow twice a day for 10 days. And for oral mucositis caused by chemotherapy, a mouthwash with 50% yarrow extract, 15 ml 4 times daily for 2 weeks. For tonsil inflammation, a tincture with 0.4% yarrow, 15 to 25 drops 3 to 6 times per day. For eczema, a multi-herbal extract 3 times per day for 2 weeks. For menstrual cramps, a tea with 4 grams of flour 3 times a day for the first 3 days of 2 consecutive menstrual periods. For IBS, a multi-herbal capsule 3 times a day for a month. For multiple sclerosis, 250 to 500 milligrams of yarrow extract per day for 1 year. For liver failure, a multi-herbal capsule with 16 milligrams of yarrow, 9 times per day for 6 months. And for chronic kidney disease, 1.5 grams of yarrow powder 3 times a day for 2 months. The unofficial dose recommendations by natural health blogs are 2 to 3 cups of homemade tea with 1 to 2 teaspoons of dried yarrow per cup per day, and 20 drops of homemade tincture diluted in water 3 to 5 times per day. Applied to the skin, yarrow can soothe eczema, reduce inflammation, fight bacteria, and heal wounds. The plant is rich in antioxidants, and it can help with diabetes, heart disease, anxiety, IBS, and cramps. More research on its potential health benefits is required. Ready-to-use yarrow products are widely available, and if you enjoy growing your own medicinal herbs, yarrow can be a great low-maintenance addition to your garden. For more information about herbs, supplements, and natural treatment plans, check out my website.